Hello, everyone. Welcome to my show. Autumn is here. I'm your host, Francine Crawford, and today we have a familiar guest with us. He is the Senior Vice President of Health Plan Growth with Elderplan HomeFirst. You may remember him. We talked about Medicare and Medicaid before, so we want him to visit with us again and give us some more information. So welcome to the show, Mr. Frank Polanco. Welcome.
Hi, Francine. Thanks for having me back. As promised, we're here to talk a little bit about the Medicare, Medicaid basics. And once again, thanks for the introduction. My name is Frank Polanco. I'm the Senior Vice President of Health Plan Growth at Elderplan HomeFirst, which is a member of the MJHS Health System. We're a not-for-profit organization here in New York City. And of course, again, happy to be on your show again, Francine.
Well, we're happy to have you. You know, it's so much information with that, and it's so important. So let's just go right into it, get started. Can you give us just a little bit about Medicare? I know that we've done a show before, and you gave us some information on Medicare and Medicaid. So can you just give us a little bit about what is Medicare and who qualifies?
Absolutely. And I guess what we're doing a little bit differently, Francine, than what we've done in the past is we have some visuals for you, a slide deck. That we'll give you some, a little bit of visual on the Medicare program. And we could start with the familiar card, that probably most folks with Medicare are familiar with. This is your Medicare ID card. Medicare is the federal government's health insurance for people that are 65 years of age or older or who have certain disabilities. So it's the federal government's health insurance program. And that is the most general definition, that you can give it. It's sponsored by the U.S. Social Security Administration. People who have Medicare are called beneficiaries. And every year, if you're in Medicare, you probably, this little book that's up on the screen right now is probably very familiar with you because you get a new one every year. And it tells you all the Medicare benefits and any change that might have come, with your Medicare from the previous year. Now, just some history about Medicare. It started back in 1965, was when the Medicare program first started. And it's had some changes, over the years, some major changes. And one of the changes we'll talk about on this slide. And we'll start with Medicare Part A and B. Most people are familiar on their card. They see a Part A effective date and a Part B effective date. Part A covers all your hospital stays. Part B covers your doctors, and then Part D covers your prescription drugs. So when you just specifically about hospital stays, it's inpatient hospitals, skilled nursing facilities, home health, hospice care. These are covered by Part A. Part B, you have doctor visits, outpatient rehabilitation, urgent care, durable medical equipment, outpatient lab tests, x-rays. That's all covered under Part B. Now, most people get Part A for free. If you worked in this country for 10 years or 40 quarters, you get Part A for free. Although some folks who do not meet that criteria can pay for it if they need to. Now, everybody pays for Part B, and the amount that you pay for your Part B depends on your income. And Part B, they don't send you a bill of premium. It comes straight out of your Social Security check every month. So most folks might know that at 140, 150, 160, depending on your income, comes right out of their Social Security checks. And Part D is the part of Medicare, original Medicare, that covers your prescription drugs. Now, some time ago, Medicare Part C was added to the equation. So what it does is it combines Part A and Part B, and you can get it through a private health insurance company like Elderplan. Elderplan is a provider of Medicare Part C, or some people call it Medicare Advantage. And right now, approximately 50% of all Medicare beneficiaries in this country choose to get Medicare Part C instead of original Medicare. And Part C, you can get standalone, so it just covers the Part A and B benefits, or you can get it in conjunction with Part D. So you can get a Medicare Advantage, Part C and D combined. Any questions? I know that's a lot. It's a mouthful. But
I just want to make sure. Like you could get A for free, correct? And
most people get A for free if you've been working here for 10 years or 40 quarters.
Okay, all right. So most people get A for free, and just in general. But you can have A and B. and there's a Part D, which is just for drugs. Now, you can also pick a Medicare Advantage program and have C, which is a combination of A and B, correct?
Yes, with a private health insurance
Private
company
health insurance.
like Elderplan provides Medicare Advantage plans. Yes.
Okay. And then you can also choose, if you have that coverage for Medicare Advantage, you can add Part D with the Part C.
Correct. You can choose to have Part C standalone and not get and not have it attached to a Part D plan, or you can get the combination of C and D in a Medicare Advantage plan. And I'll give you an example. Sometimes a veteran in this country who can get services at the VA and get their medications either for free or for very low cost at the VA really doesn't have a need for a Part D through the government. So they would just like to get a Medicare Advantage plan that just covers their Part C, their A and B benefits, since they can get their medication, from the VA. So that's an example of somebody who really wouldn't want, the Part D attached to their Medicare Advantage plan.
Okay, so that's Medicare. So can you just explain a little bit? Let's switch to Medicaid and who qualifies for that.
So just the same way Medicare is the federal government's insurance program, Medicaid is the state's insurance program, and it's for people with low income and resources. It is jointly funded by the federal government and by the state, but is administered by each individual state. That's why Medicaid benefits in New York may be different than Florida or Illinois or New Jersey. So it's individual to each state. It's administered by the state, but it's a joint venture between the federal and the state government. It is comprehensive in its scope. It covers everything, but it's for people who have low income and low resources.
Oh, okay. But that because it's different states, every state could be different. So you have to be careful with your states and find out what the qualifications for each individual state that you're in.
Correct. Each state pays for different services at different levels. So each state administers their Medicaid program individually. And in front of you, what you have right now is what most people know to be their New York State Medicaid card. See, it's typified by, 2 letters in the front, 5 numerals, and a letter at the end.
Oh, okay. So as far as someone qualifying for Medicaid, is there an age or something? Is there general qualifications?
Medicaid has no age limit. Anyone can qualify for Medicaid regardless of age. The only requirements around Medicaid are income and resources, and those numbers change. And it's lately they've been changing. The income amounts have been raising. So more and more people have been able to become eligible for Medicaid.
Okay.
I know a lot of times folks are surprised when they believe that Medicaid is only for the very, very poor. That is not the case. I mean, the Medicaid, the eligibility amounts have changed, and folks who have a lot of need and who are sick should look and see if Medicaid can help them out.
Okay. All right. So what does it mean if someone has dual eligibility?
Awesome. Well, if you're dually eligible, that means that you have both Medicare and Medicaid, and in some instances that makes you a candidate for certain Medicare Advantage plans that are considered special needs, and you might be able to get additional benefits from a Medicare Advantage plan. For instance, Elderplan has a special needs Medicare Advantage plan for dually eligible folks that offers them a $210 OTC card. They can go to a pharmacy or a supermarket and buy health-related items or groceries. So for dually eligible individuals in New York City, there are options. There are Medicare Advantage options that offer a lot of supplemental benefits beyond the normal Medicare and Medicaid benefits.
Okay. So let me ask you a question. Does people this is good information for people who before they retire. So if you're retiring and things like that, do companies have people come in and talk to them about Medicaid, like large companies, or do they have their own people? Will they hire you to come in and speak to them about this?
Typically, large companies who offer health insurance to their employees a lot of these larger health insurance companies, they also have Medicare Advantage plans. So as people start to come to retirement age, those health insurance companies will provide them their options within that health carrier. But also, you know, once you're coming towards retirement age, you have 3 months before your birthday to start enrolling into Medicare, and CMS will start sending you out information, encouraging you to apply in your Part A and Part B of Medicare. Now, some people may choose not to enroll in their Part B of Medicare right away because they don't want to pay that premium, and they're going to keep working. So as long as you're working and you haven't retired, you don't have to choose Part B as long as you can show that you have coverage already. Now, once you lose your work coverage, you have to then enroll in Part B, because if not, then you could risk having a penalty. So when it comes down to retirement age, you could either choose to receive A and B, or you could not take B, depending on your situation and how much income you have once you turn 65.
Okay. So question, is there anything on the horizon that is different, has changed? Like you said now, the amount of income you make has gone up. Is there anything else that they're working on to make it better or more affordable for people, or just to reach more people?
Well, there have been a lot of changes, Francine. I mean, over the last few years, the coverage gap in Part D has been getting smaller and smaller, pretty much going away. They will, most recently in the news, they're talking about new federal legislation that would have dually eligible people automatically go into an integrated Medicare Advantage plan. So there are constantly this environment is constantly changing of how people receive their Medicare and the options that are available to them. Supplemental benefits, which are an important part of Medicare Advantage. We are constantly adding new and different kinds of supplemental benefits. For instance, we have a flexible card that's almost like a Visa card that they can use to enhance their vision, their dental, and their hearing. So there are a lot of new innovations that are coming to Medicare Advantage and new supplemental benefits. So it's always important, like, when we started off talking about AAP, how important it is every year to evaluate your needs. What is it that you need out of your health plan, and evaluate all the different plan options out there so that you can get what's really best for you.
Okay. So where would someone go if they had questions? Would they go online? Where would they go?
Well, we started off this conversation by showing the Medicare and You guide that comes out every year. And I think for every Medicare beneficiary, that's a good place to start when you have Medicare and You. Always Medicare.gov is an incredible place. And if you'd like to hear more about Elderplan's offerings, I mean, you could go to elderplan.org and see all of our Medicare Advantage offerings.
Okay. Is there anything else that you think that we should know? Because this encompasses a lot, and all the information is great. So is there anything else that we should know to try to simplify this, or just get all the information that we need?
Well, I think this was a really good start, and I love talking to you, Francine, and I love talking to your audience. But the understanding, I guess the most important thing to understand is that, Medicare is the federal government's insurance program, and everyone, regardless of income, will take part in the Medicare program. Part A is free to most people. Part B always has a premium, and it depends on income. And Medicaid is a state program, and that's for people who have limited resources and limited income. And it's a comprehensive program that covers everything from suits to nuts when it comes to your health care. I think those are the two most important basic things. We can, if you'll have me on your podcast again, I mean, we could go a little bit deeper into Medicare. We could go a little bit deeper into Medicaid and start talking a little bit about home care and how Medicaid pays for home care and how it works with Medicare, because there's more nuance. But I think this is a great start.
Okay. Just one more question. As if you have insurance, say if you're covered, you don't have to, just to be clear, you don't have to join Medicare or apply for Medicaid if you have your own coverage, whether it's your company or your own company or whatever. You can still stay on yours. It's not like you have to join it at a certain time.
Correct. You do not. As long as you have what's called, and the important word here is creditable coverage. So
Okay.
you have to have creditable coverage. That means that the coverage that you have has to be as good or better than what you would get from Medicaid. I mean, excuse me, from Medicare. And if your coverage is not creditable coverage, then you're at risk of getting a penalty from Medicare if you don't join as soon as you become eligible when you turn 65.
Okay, that's very important to know. Thank you so much for clarifying that. That's very important.
No, you're very welcome.
Well, thank you so much. I appreciate you coming on again and giving us this information. It's so important. It really is. And we need to start thinking about this before we get of age or, something happens. We really need to have this information so we can pick the best quality care for our needs. So thank you again. I really appreciate it.
It's my pleasure as always, Francine. Thanks. Love seeing your smile. Thank you.
Thank you. All right. Bye-bye.
Bye-bye.